Save our hospital. That's the cry from thousands of Brooklyn residents about plans to close SUNY Downstate Hospital. New York State Assemblymember Brian Cunningham will be joining me to talk about what he is doing to prevent that. Also in this program, I'll be talking with New York City Council member Mercedes Narcisse. Brian Cunningham, welcome to Brooklyn 45.
Thank you so much, Sam. Good to be back on the show.
Why do they want to close this hospital?
You know, Sam, it's an interesting question that we've been trying to explore for the last couple of months. One of the things they've indicated to us is that the hospital has struggled to make profits over the last few years and is actually in debt, a couple $1 million, $100 million this year and $100 million next year. What my colleagues and I here in the state assembly are working on, and throughout the state really, is making sure that a state-run hospital in central Brooklyn is never going to lose services or close or whatever the challenges are because of a lack of resources. We're currently in the budget negotiation cycles, and we're working really hard to make sure that we get that money to downstate, both for the expense this year, but also future capital to make sure we improve the facilities and the access to service here in central Brooklyn.
Talk about the importance of this hospital to Brooklyn.
Yeah, I mean, I'll take you back 4 years ago when SUNY Downstate was designated the only COVID-19 hospital in Brooklyn. We talk about so many times the amount of lives that were lost during the pandemic, but we don't talk about the amount of lives that were saved during the pandemic as a result of having this hospital. The hospital and the nursing staff gave people dignity in their final hours and helped to recover many. This is a hospital that literally invented MRI machine that we use globally. It's a hospital that invented Viagra for men, right? So this is also a research hospital that has given so much, not only to central Brooklyn, but quite frankly, to the United States and to the global world. And it just continues to be a gift and a gem in central Brooklyn that's going to continue to thrive and keep on giving to central Brooklyn and beyond.
A lot of people don't know that this is the only kidney transplant center in Brooklyn. Talk about that.
Yeah, so that's one of the things that people are beginning to learn more about the services offered at Downstate. I think there's been a misnomer that Downstate is just this safety net hospital here in Brooklyn, but not understanding the depth of what Downstate does, both with the kidney program, also with the infant trauma unit that we have at Downstate. So there's just so much to talk about when you talk about the context of Downstate, not to mention that 1/3 doctors of color graduate from Downstate. That's just not for the state of New York, but that's actually for the United States. So this is a university, it's a research hospital, and it's a hospital that's actually saving lives every single day in central Brooklyn. And the loss of any of its services, quite frankly, would be a devastation, not only to our community, but the greater central Brooklyn and New York City in general.
You've talked about the effect on students. There are a lot of students who relate to the people who they serve.
Yeah.
When I say serve, their patients. And very often the students can relate to their patients because they're the same color.
Yeah.
Talk about that.
Well, a few years ago, Sam, I'm not sure if I told you the story. My mom and I had an unfortunate situation. My mom passed out in church. We took her to the hospital, and we had a doctor who literally said maybe she was just a little too excited in church and didn't do any vital tests. So just understanding culture is a really important thing in terms of our diets, in terms of our experiences, in terms of the levels of stress that people are going through. We talk a lot about the Black maternal health crisis. My wife and I share our story openly about some of the challenges we experienced in trying to give birth to our first child. So there's just some things that are just cultural. And if you don't understand the culture, if you aren't a part of the culture, it's hard to teach that. And I think Downstate does a really good job of, one, attracting students of color who obviously understand the experience of being a person of color living in central Brooklyn. But also, they also have the curriculum that helps guide people who aren't people of color to understand the kind of care they need to get, particularly in central Brooklyn. So it's a critical piece of the hospital's infrastructure and the medical school.
Is there some kind of racial matter associated with this closure of Downstate Hospital?
Well, look, I would hate to describe it in that way because there's 79 distressed hospitals throughout the state of New York. Downstate just happens to be one of them. But what we've heard from the community is that one thing that felt a little bit racial was the fact that legislators and SUNY and governor have made a decision 160 miles away from the hospital without a lot of community input. So I think one of the things that we've been able to do, to the governor's credit and to SUNY's credit, is reset the table, and really have a conversation that says decisions that are made 160 miles away from the hospital must be made in collaboration with the hospital. It's one of the reasons why I drafted legislation to make sure that we did two things. One, we allocated $100 million this year to make sure the debt for downstate is covered, $300 million in a lock vault towards future capital repairs. We did hear that downstate has some capital issues, and as a state and a state hospital, we have a responsibility and an obligation to make sure we fund that hospital. It's a hospital that has not received a lot of funding in the last few years, and we're looking to make sure this year we begin that conversation. How do we make downstate better? How do we close these debts? And how do we work with our federal partners, quite frankly, right? Because the onus is also on the federal government. Most of the hospital patients at downstate are Medicaid and Medicare recipients. And what people don't talk about is the fact that 30% of the money is actually paid when they receive services at a safety net hospital. The federal government, hopefully after November, can do a better job of making sure that we resource these hospitals in a way that the reimbursement rate matches the services that they're delivered at this hospital. So we have a lot of work to do, Ed. We have a lot of work between now and the deadline of getting the budget passed. We're a few days late at this point, and I can imagine it'll be a week or two off. But it's better to get a right budget than an on-time budget. And my colleagues and I are dedicated up here in Albany to make sure that gets done. And again, working with the governor and working with the SUNY chancellor to make sure this happens and this plane lands safely. And we have a commission to study what went wrong and how do we prevent this from happening again.
What's going to happen to the nurses and staff if this hospital closes?
Well, the thing is, the medical staff, obviously the doctors and nurses, there's a medical shortage. So there's no shortage of jobs for medical professionals. But what I hear overwhelmingly from the UP workers and the folks who work at downstate, this is not about having a job. This is about working at this hospital. They selected and chose to work at this hospital to serve this community. And this is a place where many have been for 25 and 30 years. Certainly, if you enjoy what you're doing, you enjoy what you're practicing, and you're helping to save lives in the community, that option should be there for them to do that. What the proposal said in January was that we would open a new wing at Kings County and create a wing of downstate at Kings County. Obviously, this wasn't a proposal that was discussed in consultation with the community. And we reset the deck and said, you know what, we're going to have a community conversation with a community advisory board, with a commission of professionals to study this. And we're going to move forward with a plan in a year that makes sense for this community, not one that was drafted again in Albany. And I am an Albany legislator, so don't get me wrong. There's a lot of good things that come out of Albany, but part of those good things that come out of Albany is my ability to put my ears on the ground in Brooklyn and bring those ideas back to the state capitol.
Someone said that Downstate Hospital usually take people who can't pay. Now, you talked earlier about Medicare and how Medicare helps, but how does this hospital help residents of Brooklyn who can't pay?
Well, certainly, and we've done a bunch of community conversations with both the medical team there as well as the fiscal team there. And what we discovered is that one of the first questions that you usually get at a hospital is your ability to pay. And if you can't pay, you don't get services. Downstate certainly does not look at your ability to pay. There are a bunch of other programs they try to tap people into and connect them to make sure they, one, get the care they need and deal with the payment piece after, whether that be a payment plan, whether that's tapping into, maybe they have not applied for certain benefits like Medicaid and Medicare and are available to apply for it. They try to connect people. So it's really a hospital that's connected and centered around this idea of a community first model and making sure community residents feel that they're not just a patient, but a part of their family. And I think that's part of the care you receive. We all know that there's nothing better than being taken care of by a loved one. And that's a close experience that many Central Brooklyn residents get when they talk about the care they get at SUNY Downstate. Again, we can certainly do a better job of making sure the services improve at the hospital. And we certainly want excellence from our hospital, but it starts with saving the hospital and making sure they have the resources on the ground they need.
I know that you and your colleagues have been working with several unions to ensure that this hospital does not close. Talk about the cooperation that you're getting from these unions.
Yeah, I mean, I got to say UUP and PEF and all the labor unions have been phenomenal in terms of working together. There's a great analogy that when clergy, elected officials and unions get together, there's nothing we can't do. And we've seen this with the concerned clergy of Brooklyn who've come together and rallied around this, both echoing their congregations, but also understanding their obligations to the faith community to make sure faith without works is not dead. And there's also the component of union, and it has so much muscle and might, and we use in our platforms here as state elected officials to echo that. So I think there's been a lot of unison, a lot of harmony, and there is strength in unity, and we continue to plan that unity, not just to save downstate, but to strengthen downstate and to make sure that Brooklyn gets its fair share in the state budget.
Let's talk about unity, not only with unions and religious leaders and so on, but unity with the communion, with the community.
Absolutely.
What do you want the community to do?
I need the community to stay behind this and stay focused. So the first goal is, one, to make sure that the bill that I propose gets passed. So they can definitely just call the state representatives, let them know how important it is, call SUNY, call the governor to get this bill passed. But more importantly, the day after we celebrate saving downstate from this aversion, focusing our attention towards the federal government, like I mentioned, and making sure that this doesn't happen again, that we get the federal reimbursement rates we need, and that we also get some federal funds to help us build a world-class facility. The state alone can't do it. I'd be misleading and misguiding if I said that. But we certainly can make sure we stay together in this fight to make sure that we're not doing this again in the next 10 or 12 years.
New York State Assemblymember Brian Cunningham, thank you very much. I wanted to ask you about the transformation plan, but we've only got 30 seconds.
Well, the transformation plan is now transformed into listening to community and making sure that we echo their voices. That is true transformation, when we listen to people who are being served by that institution and making sure that their voices are reflected in whatever we do moving forward.
And that's very important, that you are listening to the community and the community can depend on you. I keep stumbling over this word community.
It's the most important word.
But I want to thank you very much for being on Brooklyn 45. And I want to congratulate you on your young child.
Thank you so much. We want to make sure Downstate's here for him when he has medical challenges or medical needs. So we're grateful to welcome into our family and our community.
Okay. Well, thank you for being our guest on Brooklyn 45.
Thank you.
New York City Council member Mercedes Narcisse, who has a lot to talk about. Council member Narcisse, welcome to Brooklyn 45.
Thank you. I'm happy to be in the space with you, Sam. It has been a long time. Yes, right now I represent the 46th district, which cover a large part of Brooklyn, from Canarsie all the way to Shipshead Bay, and being chair for hospital committee. So I hear you loud and clear. I'm here.
You're chair of the hospital committee.
Yes, sir.
Well, there are a lot of mental health issues that we hear about on the news almost every week. Let's begin by talking about how your committee is addressing those mental health issues.
Mental health has been a big problem in our community, in our society. Mental health is integral component overall of our health. If we're not healthy mentally, you cannot function, Sam. It play a key role in everything that you do. If you actually your mental capacity is not there, you cannot pay your rent, you cannot go to school, you cannot do anything. So it is important that we address mental health. For me, the minute I got elected as a registered nurse, I was looking at different issues that I can tackle. And one of them, one of the big bills that I had to tackle on is autism, because autism, we had two young folks that got arrested, and police officer did not know that they have autism. They were autistic, they had autistic disorder. And to that, I quickly collaborate with many organizations, my TAMEC, and see how we can address that. And beside that is everything about mental health. Anytime that you cannot function mentally, you can see that on the street of New York City. It's hard for us, and we need to address it ASAP. That's why whenever you have cut in the hospital, whenever you're closing a hospital, is a chance for us to lose opportunity to address mental health.
Let's talk about housing. And we read on the news all the time, and we hear on the lips of many people that we have a housing crisis in New York. What is City Council doing about this?
We've been working very, very hard. Housing has been a problem for a long time, and more than ever now we are in a crisis with the migrant situation, even make it worse. We know NYCHA, we had vacancies, so now we're pushing for bills where we can repair those vacant apartments. We have folks that whenever we have any big development in our community, we know what happened when we're talking about AMI and all that, and our folks are not qualified for them. And now, as a matter of fact, this afternoon, I was talking about how we need to address housing issue when it comes to folks that serving our community, like whether you're a Coast Guard or you work for sanitation, any low income average citizen that working in our community, we have to look into ways where we creating opportunity for them to have an apartment. And if we have homelessness, like we have veterans, we have so many folks that serve our country, that serve our community, and we prioritize that. We making sure that any development, like for me personally, any development that we have to reserve space for veterans. We have to reserve space for people that live in their community so they can stay in their community. People are being pushed out every single day, and it's unfair to folks that have been serving our community. So we are very dedicated to that. Any development that taking place in our community, as council member, we've been pushing for that to make sure that our people, the people in the district, wherever we serve, are relevant.
Is the migrant situation, you mentioned migrants a little while ago, is that situation affecting your district? And then we're going to talk about how is affecting New York as a whole. But let's talk about, is this affecting your district?
Tremendously. I have one of the largest migrant places in my community, Floyd Bennett Field. We have over 2,000 migrants in there. And of course, it's just like a different issue that we have to face. We have to remember it's federal because we don't control the border. The people are here and it's illegal to put demand on them to do certain things. So at the same time, we have to provide care. We have to make sure that they have a space where they can sleep and they can be safe and their children go to school. And it's creating a lot of argument of what do we do with migrant, but there's a human being. They deserve our support. They're already here in our city. So the best we can do is making sure that they have a place to stay, they're safe, they have food, their children can go to school, and then until we can see the process. Remember, we need the federal level, and the federal have not been responsive to us at all, and federal, and we have not got the support that we're supposed to get. And right now is a crisis in our hands. We already have people that need housing in our community, and now we're facing with a large population of migrants, over 53,000 now in our shelter, in our HERC spaces that we have. It is a big problem in my community.
You are not a new member of the City Council. But you have not been there for as long as so many other council people. On the question of money, does the fact that you have not been there as long as others affect the amount of money and resources that you get?
Even though I just arrived, I have to tell you, I have been able to bring not only the bacon home, I've been able to bring the whole pig home, because there is inequities in my community, and I wanted to address the inequities in my community. For my first year, I was able to bring more than $40 million in my community. I'm addressing every school building. I spoke to every principal, every superintendent in my district, and we're able to allocate funding for libraries. I'm rebuilding libraries. I'm able to put science lab. I'm able to address bathroom in my community. So it is the right time. Let's say that it's not high, how many years that I have been in office, is how many years I have been serving my community and understand the process. And with that, I have been blessed because that's the first time we have over 34 women serving, and the first time we have a Black woman as a speaker in the city of New York for city council. So I was able to collaborate very fast and understand the process, and I've been able to work closely with the process of budget and negotiation, because I am on budget and negotiation. So I'm able to see where the dollar's flowing, and I was able to bring money from the first year in office.
Let's get back to the migrant situation. The mayor has said that he wants to see changes to sanctuary laws. What is the city council going to be doing about this?
We have to be mindful when we're talking about migrant, you don't have papers, I'm gonna call ICE and all do that. Just don't remember, just don't forget that we have a lot of our own people right here in our community, because this is a city of actually, we're supposed to sanctuary city mean like we welcome people. We understand that we build on immigration. The whole country is built on people like migrating from different time. In 1800, it was the Irish. In 1900, was the Italians, so forth. So people are looking for a better place for themselves and their family. So whatever the law that we put in place, we have to make sure that we're not pushing the very own people that's serving the community for years. We still have people that overstay their time and don't have papers. So if we start going that route, it's bad for the city of New York. Yes, it's a lot of folks. Yes, we just have to make sure we address the immigration reform that we need to do in the federal level. But as far as the city, I don't see myself signing anything to push people that just newly arrived. People are looking for opportunities. It's not that I'm going to open the gate, because we don't have that power, the federal power to do that. But we asking that President Biden look into a way of doing immigration reform. In the meanwhile, our brothers and sisters that just arrived, we need to get the law in order. We need to get the lawyers in place to see the process through. Those that qualify to stay, and those that not qualify, and that's the process for the lawyers to determine that we hired to do the job that they're supposed to do.
We've been hearing in the news very often all these robberies that are associated with immigrants and gang activity. And the mayor has said that he wants to see a better relationship between the police and the immigration authorities. How are you going to be addressing this in the city council?
It is unfortunate that folks that giving bad name to folks that come to look for a better life. In every process, we have bad apples. In every system, when you have a large population of folks, you're gonna find a few folks that are doing the wrong thing. But having said that, I will not judge based on that to say every migrant that came to New York City are causing trouble. But if you do cause trouble, you kind of breaking the law in the city. Of course, there should be a process for everyone that break the law, period. But having said that, I'm not gonna put it one size fit all, saying all the migrant this, all the migrant are thieves, all the migrant is causing trouble in New York City. No, we have to go through the process, to the legal process, to see who qualified to stay and review the papers. And if you cause any trouble, you have to go through the process like everybody else.
You talked about what you have done as city council member. What are the needs that you see as relevant to your district?
What's relevant to my district or to the New York City is still the same problem that we face. The housing crisis is for real, and we try to address it on a daily basis. And in my office, ever since I got elected, I have 3 different lawyers in my office. I understand the need of my community. I have an immigration lawyer, I have a housing lawyer, and I have a lawyer that can address the will and trust of our people, because we know a lot of folks don't want to deal with the trust. They don't want to think about that I will die one day. But it's important for generational wealth that we need to address in our community. And when it comes to school, like I said, I'm addressing that, putting a lot of programs, because idle hand, I don't mind, you know what it does. So for me, as a mother of four and being a nurse working in the community, I'm providing all those support, all the workshop, and encourage people to get involved, to get engaged, because the process is not only for Mercedes, it is for us to see, to have the vision for our district and the city at large. Because when you're talking about budget and negotiation, it's not only for my district, I'm on the budget and negotiation to see the whole city of New York. As a chair for a hospital, our hospital being closed, and right now, Medicaid reimbursement is 30% less than actual cost of the services, that we cannot afford that anymore. And we see that's what happened now. We're having Downstate at the brink of closing. We have, we already had Kingswood problem, and then now is more hospital. We have Brookdale have issues. So it is imperative for us to come with a plan. And what I have to say, if I have to say anything, is a message to the governor. We need to increase that Medicaid rate. Because most of the people, underserved population in our community, happen to be on Medicaid. And if we don't do that, all our hospital will be closed. And those are all the things that is very important to me. And I'm pushing forward to make sure we have the best quality education in our community. Our healthcare is being addressed. And then our housing issue, we cannot close eyes on them. All the vacancy in national houses need to be addressed. And we need to create more opportunity for our people that work for the city of New York.
Okay, New York City Councilwoman Mercedes Narcisse, it's good to have you on Brooklyn 45 again.
Thank you. I appreciate your time. I appreciate you guys. Thank you so much for the opportunity.
We also want to thank New York State Assemblymember Brian Cunningham, who talked about his plans to keep SUNY Downstate Hospital from closing. And to you, our viewers, we thank you for watching this program. We invite you to partner with Brooklyn 45, and you can do this in many different ways. We are a 501c3 community television program. When you support us with a gift, you benefit, and our communities benefit as well. Please tell your family, your friends, and your work colleagues to watch Brooklyn 45 programs on cable TV and on YouTube, youtube.com/Brooklyn45TV. Please support us and be a part of what we do. On behalf of our Brooklyn 45 team, I am Sam Taitt.
Brooklyn 45 is a 501c3 not-for-profit, and we welcome your support. Check out our website, brooklyn45.com, and feel free to donate or share it with your friends and family. Have any comments or questions? Send them to our Facebook, facebook.com/Brooklyn45TV. If you have any questions or topics you think we should cover next, shoot me an email over at brooklyn45tv@gmail.com. Thank you again for watching.